Dorothy Betancourt. I'm going to be 88 in December. I've been under Sutter care for 5.5 years.
Advanced Illness Management is a care management program that was designed for individuals with multiple chronic conditions to support those individuals and their support systems in managing their health and well-being.
I was just here home one day, and a lady called and said, I'm a nurse from a program that we call AIM, and can I make an appointment to come over and check you out and see you at the house? So I said, okay. So we signed up, made an appointment, she came, and I was really impressed with her.
When I met Dorothy, she had not started treatment yet. We really encourage patients to have goals of care and to be involved in the goals that are made. In fact, Dorothy's first goal of care was to be independent in her home, and she's independent in her home.
When looking at why person-centered care is important and why care is delivered holistically, the priorities are really focused on what that individual's goals are and helping those individuals gain confidence and independence in managing those illnesses.
And it's so helpful to kind of prepare them to walk with them through it. And in Dorothy's case, this is a perfect example. I mean, she's almost back to what she was when I first started here. She is up walking around. She's as independent as can be.
We had a concept where it was the team that cared for a patient and not one person. We also looked at some core pillars: symptom management, self-management and supporting that patient and increasing their confidence in the self-management, follow-up visits, making sure that we had follow-up visits after a hospitalization within 48 hours, advanced care planning, that we focused on what the individual's goals were, and all of the care around them and the support was based on what their goals were.
I know that the AIM nurses are out there, and anytime I need them, I can call them, talk to them, ask to see someone, and I feel like I'm not alone anymore.
Some initial results that we saw were patients and families were more satisfied with the care that was delivered. We saw that providers were more satisfied with the care that they and their team delivered. We also saw a benefit in regards to individuals being able to age in their home and stay in their home as their illness progressed. We saw 50% reduction in hospitalization. We saw 98% completion in advanced care planning. We saw a significant decrease in ICU days in the last 30 days of life. And I think as long as we stay focused on delivering high quality care, we'll be able to deliver whatever payment model ends up in the future. And from our teams, we're actually seeing that our clinicians, our nurses, and our therapists are actually happier with the care that they're delivering. And they feel like this is why we got into healthcare, was to make this type of a difference. It's the difference between an individual having dignity and being able to age in the environment that they choose.